Good afternoon, everyone. We are very pleased to have you joining us today. My name is Tracy Archibald from CMS. Thank you for joining the National Learning and Action Network event, State Partnerships to Support COVID-19 Prevention and Response in Nursing Homes. Today's goal is to provide an overview of the different activities and resources that state healthcare-associated infection and antibiotic resistance, or HAI-AR prevention programs, and the Quality Innovation Network Quality Improvement Organizations, or QIN-QIOs, are offering to assist nursing homes during the COVID-19 pandemic. Today you will hear from our CDC colleague, Dr. Joseph Perz, members from the QIN-QIOs and from the state HAI-AR prevention programs. A few reminders before we get started. Thank you for taking the time to be here with us today. The slides and recording from today's session will be posted to the QIO program website at www.qioprogram.org, so be on the lookout. Next slide, please. Our topics for today include showcasing the expertise and valued resources provided by both the HAI-AR prevention programs and the QIN-QIO program, including how these organizations are collaborating to provide the most optimal experience for nursing homes. It is my pleasure to introduce Dr. Joseph Perz, who is the Deputy Branch Chief in the Division of Healthcare Quality Promotion at the Centers for Disease Control and Prevention in Atlanta, Georgia. Dr. Perz entered the field of public health after training as an engineer and environmental scientist. After receiving a doctorate in public health from Columbia University, he served as an Epidemic Intelligence Service Officer with the Tennessee Department of Health. During his 20-year tenure with the CDC, Dr. Perz has guided dozens of outbreak investigations and special studies. His team's activities are currently focused on interagency collaboration, providing support to health departments, and other partnership efforts aimed at expanding prevention and response activities across all healthcare settings. I will turn the call over to Dr. Perz.
Thank you so much, Tracy. Thanks, everybody, for joining this afternoon. Next slide. As Tracy mentioned, I'm going to get us going here with an overview of HAI-AR prevention program resources for nursing homes, and I'll tell you about how we connect our activities here at CDC at the agency level with those programs. Next. First, I want to begin with a big thank you to all the frontline nursing home staff and administrators across the U.S. These have been very challenging times. You've saved countless lives, and we thank you from the bottom of our hearts. We also acknowledge, again, CDC we try to be there on the front lines to the extent that we can, but the reality is that the day-to-day service to support nursing homes, a lot of that is coming from, of course, our state and local health department partners, and we thank them. And I'm just going to take a few slides here to sort of orient you guys to what I'll call, the public health approach, which focuses on three activities primarily: prevention, surveillance, and response. Next slide. So I think you're all very familiar at this point, with CDC guidance providing an underpinning, for the work that we do to prevent the spread of COVID in nursing homes. So I won't say too much here, but I will acknowledge that there's a lot to keep up with. You'll notice that the most recent guidance, as indicated in this screenshot, was just updated on June 25th, so less than a week ago. So I encourage you to do what you can to stay up to date and use your QIN-QIO and HAI program partners to help you stay informed. The essence of our guidance, I think, can be distilled as keep COVID out, detect COVID early, and contain the spread of COVID. Next. Prevention also includes, of course, training, right? Having guidance, it can be great on paper, but having it in the hands of those who need it takes a little bit of extra effort. And so we've developed, just here, it was one example, a mini webinar series, and you can follow the URLs to access that training, and you'll find much additional useful training on the CDC website. Next. Surveillance. is how we know what's going on where. And CDC's contribution here primarily has been in the form of the NHSN long-term care facility COVID module. It layers onto the active surveillance efforts that have been in place from the very beginning of the COVID epidemic at the local and state level. So I'll transition on the next slide to the idea of surveillance primarily providing us data for action. Health Department notifications for COVID-19 are of primary importance. Of course, they're also required, as illustrated there with the little screenshot or image of the CMS policy memo. But the takeaway here is to engage public health as soon as there is knowledge of or even suspicion of COVID in a nursing home or other long-term care facility. We also have emphasized throughout the COVID response the importance of having communication plans that include residents, family, and staff so that everybody's on the same page and aware of what the facility is doing to prevent and contain COVID when it enters. Next. Response. Response refers to what we do collectively when we have a signal that something is affecting our residents. In this case, the spread of COVID. It's not unlike the response that you would muster traditionally for other respiratory illnesses. In other words, we've always, I hope, been really attuned to identifying early clusters of infection and responding to them. But more than ever, we're asking our nursing home partners to work closely with our health department partners to manifest an effective and timely response to contain the spread of coronavirus as soon as possible and to minimize harm to our patients. Next. As I said, CDC works primarily through its health department partners, and we are fortunate that we have been able to fund and organize what we call HAI-AR programs in all 50 state health departments and a number of additional health departments beyond that. In fact, this work is increasingly reaching to the local level, and I'm very pleased to see that. Again, the underpinnings are prevention, surveillance, and response. What we'll focus on in just the next few slides is a prevention activity that both health departments and QIN-QIOs have been very active in lately, and that is the ICAR program. Next. So ICAR refers to a strategy or approach involving standardized assessment tools. These are used to assess infection control practices in a variety of healthcare facilities. They're used to guide our quality improvement work primarily. And for COVID, CDC did develop early on in the epidemic a specific ICAR tool. And not only that, but one that's tailored for use in nursing homes. Next. Our HAI programs have been very active in terms of taking up the ICAR activity, so I'm sure that many of our long-term care partners who are on the call have already had experience with health departments and increasingly with their QIN-QIO partners in terms of deploying ICAR. Health departments will use ICAR tools in the context of outbreak investigation and response, and that's very important, and that's highlighted in the blue bar, or I think it's actually the green bar portion. I'm sorry, I'm getting a little lost here. But you can see that, the blue bars represent ICAR use by individual state health departments, and so those numbers have increased steadily to the point now where probably 85% of our state health departments have used ICAR in the context of COVID outbreak response in nursing homes, and then nearly an equal proportion have been using it in a preventive capacity, reaching out to facilities that have not yet experienced COVID to make sure that they're better prepared. And by the middle of March, we'd already seen the health departments complete over 4,000 preparedness ICARs. So that's reaching, at that point, already over a quarter of nursing homes nationally. Next slide. And then I'll just conclude by saying that, there's been a lot of need for surge capacity in many aspects of the COVID response. And so one aspect where CDC has lent a hand is when we identify states that need extra help, we've actually been able to, take on some of that ICAR activity and perform those remotely. We call that a tele-ICAR. And so we've had a team staffed here in Atlanta that's been very active in that area, and at this point has completed over 700 of those preventive ICARs. I'll just note some of the common gaps identified. Those include issues around PPE and their correct use. A lot of that, of course, comes down to having the correct forms of PPE and being trained on them. We have issues that persist in terms of disinfectant contact times not being adhered to as well as they should, and then what I would call an under-reliance on alcohol-based hand sanitizers, right? In the long-term care space, there's been maybe an under-recognition of the preferential use of alcohol-based hand sanitizer. And very encouragingly, the ICAR really is performing as a quality improvement tool, as you see here, where 70% of the facilities that we followed up with reported making changes to improve practices post-ICAR. And so with that, I'm going to turn it back to our hosts, and I thank you very much for your attention.
Thank you so much, Dr. Perez. We'd like to open up the phone lines and also provide our participants with the opportunity to enter any questions in the Q&A box on your screen. And the question we'd like to run on is, what are some best practices you have applied to implementing the tele-ICAR during this pandemic? So we'll see if there are any thoughts from the phone line.
Thank you. If you would like to ask a question on the phone lines today, please press *1 on your telephone keypad. If you are on a speakerphone, please make sure your mute option is turned off to allow your signal to reach our equipment. And again, everyone, that's *1 to ask a question on the phones.
And
There
Angel,
are no questions at this time.
Thank you so much. Angel Davis and Sophia Autry from CMS will help with facilitating some of the Q&A box questions. Angel?
Yes, thanks, Tracy. So we do have a question from Susan Grayson, who's asking, is there a COVID-specific ICAR, or are you using the one we used prior to ICAR?
Yeah, thank you for that question. There is a COVID-specific ICAR. It's a little bit streamlined relative to the one that you're familiar with, but it also has some additional elements that are specific to COVID preparedness. So we do recommend that you identify the COVID-specific version of the nursing home ICAR tool. Thank you.
Thank you, Joe. And Tracy, at this time, we do not have any additional questions in the Q&A box.
All right. Thank you so much. I wanted to introduce the next section of our program today. I wanted to introduce the QIN-QIOs program. There are currently 12 QIN-QIOs that cover the country and support nursing homes in different ways depending on the individual needs of nursing homes. You can locate the QIN-QIO for your state at www.qioprogram.org. We would now like to highlight some examples of how the QIN-QIOs and HAI-AR prevention programs are collaborating. And it is my pleasure to introduce Gina Partington from the QIO Alliant Health Solutions. who is the program director for Alabama, Florida, and Louisiana. Gina is a registered nurse with over 35 years of experience, including over 20 years working in quality improvement and patient safety. She is a double board certified in healthcare quality and patient safety. She has worked in the QIO world for over 11 years, 6 of those with Alliant Quality. Gina, the floor is yours.
Thank you. Thank you, Tracy. And thank you so much for inviting me to share the important work toward COVID-19 preparedness response in Alabama nursing homes that was done and continues to be done with Alliant Quality partners. Next slide, please. These partners include, and I want to do some shout outs to Melanie Shervani and her team at the Alabama Department of Public Health, Katrina Magden and her team at the Alabama Nursing Home Association, Dr. Namali Stone and her team at the CDC, and Beth Green, Alliance Senior Quality Advisor and boots on the ground in Alabama. Next slide, please. This slide shows the timeline of the CDC deployment in Alabama following their review of nursing home tele-ICARs in April. The CDC reached out to Alliant Quality as the QIO in Alabama for brainstorming, and we pulled in the Alabama Department of Public Health, the State Survey Agency, and the Alabama Nursing Home Association as important stakeholders to discuss what we would want to achieve with a targeted outreach, and I'll share those goals shortly. Then the Alabama Nursing Home Association reached out to their members to ask for volunteers for on-site visits from the CDC and team. The visits included training on infection prevention and control and proper use of PPE. 24 facilities volunteered. The visits were conducted over a period of 10 days at the end of May. Next slide, please. These were the goals for the on-site visit. The team wanted to evaluate the COVID-19 preparedness and response efforts of those homes, utilize the ICAR tool to review infection prevention and control practices, the home's capacity and readiness to care for residents with COVID-19 infection, and also to work with nursing home providers as partners to discuss challenges that they may have with implementation of infection prevention and management practices. So they ultimately learned that partnership, of course, between public health and nursing home partners can build capacity to support and care for people and residents and patients with COVID-19 infection. And they did identify opportunities for improvement and support that the long-term care facilities could use. Next slide, please. So we do have some wonderful next steps, which include the continuation of support and partnership in order to share best practices, continuing common challenges and solutions to address access and resource limitations. Starting June 16th, there was the kickoff of a twice-a-week 30-minute office hours. The initial call reviewed the results of the on-site visits, and ongoing topics are identified through feedback, trending questions, any identified needs, such as any NHSN questions or technical assistance needed with reporting NHSN or getting access to NHSN. And it's always started with any updates that might have been released from the CDC related to any guidelines, and continued sharing of any best practices. Also, we recently initiated a monthly HAI huddle, which is led by the Department of Public Health. And the first call was just this past Friday on June 26th, and it was reviewed for the videos that the CDC has for donning and doffing PPE, and then some Q&As after that as well. Next slide, please. So as a final comment, I would like to share that some exciting news. We were just notified today by CMS's Center for Clinical Standards and Quality that 100% of Alabama nursing homes are reporting COVID-19 data in NHSN. Well done and congratulations to the Alabama nursing homes. Next slide, please. So I would like, and it is my pleasure, to introduce Erica Washington, an epidemiologist at the Louisiana Department of Public Health. Thank you, Erica.
Thank you so much. Louisiana's Healthcare-Associated Infections Program is fortunate to have a long experience of collaboration with quality improvement organizations. Alliance Health's intersection with Louisiana facilities is relatively new. Prior to COVID-19, their aims were to recruit 172, or 61%, of nursing homes for an enhancing antibiotic stewardship program to reduce infections such as C. diff. COVID quickly shifted our efforts to containment, as Louisiana was one of the initial jurisdictions that identified a large number of cases early in the United States COVID experience. The Louisiana Office of Public Health conducted tele-ICAR surveys that were developed by a team of CDC Epidemic Intelligence Service officers who were deployed to New Orleans in March. Our ICAR efforts expanded when multidisciplinary teams in our 9 public health regions were tasked with administering tele-ICARs to all of our 280 nursing homes, both preventatively and responsively. Nursing homes continue to be a prevention priority in our state, which is supporting COVID PCR point prevalence testing in all of our nursing facilities. In concert with this, regional ICAR teams have shifted to conducting in-person visits to offer another layer of support for facilities navigating infection control interventions, such as cohorting, as they conduct point prevalence testing. While Alliant is a QIO with many states in its purview, our HAI team is fortunate to have local support from Julie Keeker, Senior Quality Advisor for Alliant's Quality Division. Ms. Keeker has engaged with the HAI program for years in order to move quality improvement programs that focus on nursing homes forward. Julie's support comes in the form of periodic check-in calls with me, participating in weekly long-term care office hour calls that we initiated in April that are conducted by the HAI program for nursing homes, and gathering resources that support nursing homes on containment activities. The most significant example of this was when Julie shared contact information for Alliance NHSN expert, Mary Lee Johnson, on a long-term care office hour call, so that homes who were signing up for CDC's National Healthcare Safety Network could have live technical assistance. You'll recall that nursing homes participate in NHSN to remain compliant with CMS mandates, as well as to provide health departments with situational awareness. Julie has also convened a multidisciplinary nursing advisory group to bridge patient safety goals across sectors. Louisiana's representatives include the Nursing Home Association, Louisiana Department of Health Standards Section, and our HAI program. Alliance current work with us focused on infection prevention coaching for nursing facilities, which has complemented ICAR efforts from the Louisiana Office of Public Health, as well as licensing visits from LDH's Health Standards Section. An immediate outcome of such coaching has been keeping our homes up to date with guidance from CDC and the Department of Health. And anecdotally, I'll note that I've received feedback from nursing homes in the field who have praised webinar training content produced by Alliance. That concludes my comments, and I thank today's organizers for allowing Louisiana's experience to be shared.
Thank you so much. We wanted to open the phone lines and look in the Q&A for any discussion from our participants on what you find most helpful in if you've participated in one of the open office hour calls, or if you have any questions for our speakers.
As a reminder, everyone, that's *1 to ask a question on the phone lines. All right, there are no phone questions at this time.
Do we have any questions in the Q&A?
Hi,
Okay.
Tracy.
Sorry, go ahead, Angel.
Okay. We did have a follow-up call. A follow-up question for Dr. Purz. Can you tell us where the COVID-specific ICAR is located? All right.
Sure. Yeah.
Go ahead.
Sorry, I just put it in the presenter chat, so I hope somebody can display it for the entire audience. It is on the slide where I highlighted that ICAR tool, and basically it's the cdc.gov/coronavirus website, and if you search for the long-term care pages, it'll pop right up.
Thank you so much, Dr. Purz. I am now going to move us to our next QIN-QIO speaker. Jennifer Wachowski serves as the California Senior Executive Director for the Health Services Advisory Group, which is the QIN-QIO for California and Arizona. With more than 17 years of experience working in healthcare quality improvement with community providers, including hospitals, nursing homes, home health agencies, and community-based organizations, Ms. Wachowski is responsible for providing oversight and direction to the tasks associated with the QIN-QIO work, under contract with CMS to improve the effectiveness, efficiency, economy, and quality of services delivered to Medicare beneficiaries. Jen, I'll turn the call over to you.
Okay, great. Thank you, Tracy. Hi, everybody. My objective today is to share two examples of how HSAG, QIN-QIO, California and Arizona, how we've partnered with the California Department of Public Health, Licensing and Certification Division, and the HAI program. These days, I feel like we're on the phone all the time. Daily communication is we're both striving to provide our state's nursing homes with the tools to ensure that residents are receiving exceptional care during this pandemic. So here's the first example. If you go to the next slide, please. Talking about how our QIO through partnership has helped nursing homes with the NHSN enrollment and reporting deadline. So QIOs have had a lot of experience over the years supporting nursing homes with NHSN, which has not actually been a requirement for nursing homes until now with COVID-19. So when CMS and CDC announced the May 17th deadline to get nursing homes enrolled, our QIO, and as you heard earlier, other QIOs across the nation, we stepped up and very quickly were able to provide assistance to over 280 nursing homes in California and Arizona to help them meet that deadline. But then there was a new deadline. Next deadline was that nursing homes had to, by Sunday, June 7th, not only enroll into NHSN, but also had to start reporting data. And keep in mind, there are almost 2,000 nursing homes in California that are eligible to report. So the week before this due date, we were contacted by our state's nursing home association, CAF, or the California Association of Health Facilities, and we reached out to CDPH, our Department of Public Health, to get an update on enrollment status for our state so that we could collaborate and be there just in time to help the nursing homes enroll to meet that Sunday, June 7th reporting deadline. I hear some other, I'll keep going. So anyway, by June 7th reporting deadline, we were able to help the nursing homes. And there were, okay, great. I hope you all can hear me now. And so there were 91 that still needed to enroll by that deadline. So at that time, we were partnering closely with the Department of Public Health, getting daily reports from them, making phone calls, sending emails. We hosted a webinar. We were taking calls during the evenings, weekends, anything that we needed to do to help our providers meet that deadline. In addition, CDC was right by our side. There was a lot of pressure on them to respond to thousands of inquiries. They were on the phone with us for at least 3 hours that week as we were trying to serve as that middleman between nursing home corporations and facilities that needed help, and we really thank them for their responsiveness. So overall, this example of partnership, it was intense, but it was extremely collaborative across the board, and through that effort, we were able to reduce that list of nursing homes that had still not enrolled from 91 down to 18 by June 7th. And the efforts are still not over. We want to be like Alabama with 100% compliance, as you heard earlier. So we're still working closely with CDPH and the nursing homes to do that. If you go to the next slide, I want to get into my second example of partnership that I think is worth sharing because it can be easily replicated in other states. So what this is, since May 7th, our QIO has been fortunate enough to be able to partner with our Department of Public Health and our state AMDA chapter, which is the California Association of Long-Term Care Medicine. And we're hosting statewide weekly infection prevention calls every Thursday that are averaging approximately 1,500 attendees. And the purpose is really about, again, just-in-time education, reminders, training tips, guidance, and also an opportunity for nursing home infection preventionists to ask questions fielded by experts, which I actually feel is the most important part of the call. It's very powerful, and we typically are fielding 50-plus questions in the queue at any given time. So due to that high demand, we actually started a second call last week in the format of a webinar, which is now scheduled to occur every Wednesday. So last week, we touched on testing and cohorting. Tomorrow, our second webinar will be focusing on PPE. So in conclusion, through these two examples of partnering between our Department of Public Health and us and our associations, it's been really advantageous, productive, so that we can offer high-quality assistance and guidance to the providers in our state. So at this time, I'd like to introduce Vicki Keller, Infection Preventionist Supervisor at California Department of Public Health, Center for Healthcare Quality HAI program, who's been a great partner to our QIO and has been instrumental in assisting nursing homes in California during this pandemic. Vicki?
Thank you, Jennifer. That is a tough act to follow as far as passion for what we're doing in California, and I thank you for that. It has been, it's been an exciting, we'll use the word exciting ride in California. As Jennifer said, I'm the coordinator for the HAI Liaison Infection Preventionist in California, and we visit nursing homes, we've done assessments, we've used the ICAR tool. We have actually skimmed that down a little bit specific to ICAR, as Dr. Kurz indicated. We have 8 teams of IPs, infection preventionists, that are targeting facilities, skilled nursing facilities across the state. A couple of the things that we've done that were innovative in our state and a tribute to our leadership is in training some of our licensing and certification surveyors that volunteered to be part of this program. And they were trained by our department, HAI program, in infection prevention to assist us in these 8 teams as we visit some 58 counties throughout the state to help with their infection prevention for COVID, to be ready for COVID, but then once it is in the building to help with mitigation. Some of the exciting things that we did in working in collaboration with HSAG was with these nursing homes, getting so many of them, close to 2,000, as Jennifer said, getting ready for the reporting, getting ready for reporting, how to report, what the definitions were, and the burden with everyone calling these nursing homes every single day to get data, whether it was from CDPH or from local public health. So to minimize some of the reporting burden in California, we have a daily online survey that nursing homes were required to complete. And so when we found out that CMS and CDC NHSN requirements, we modified our survey to match the CDC required questions. And so after the nursing homes were enrolled in NHSN, we had them confer rights, which now enables us to submit the COVID-19 data for them on their behalf. And we felt that this was a great strategy to minimize any reporting burden for the nursing homes and to get CMS and CDC the information that they needed to track COVID-19. We're very proud of these teams. They've evolved over time, and we've been able to get some additional staffing to help assist us. It's interesting, the calls that Jennifer spoke about, they know our names now, and once they get a hold of us, boy, the questions do come in. We have, as she said, 50 to 60 questions from some 1,500 people on these calls, which we actually started probably back in March. But we collaborated with HSAG in May, and it's just taken off. And it has really taken something that was not good in the way of a pandemic, but it has been good in the collaboration we've had between local public health, the state public health and with our partners at HSAG. So with that, I thank you for the time to be able to speak a little bit about what we're doing, and more to come. Thank you.
Thank you so much, Jen and Vicki. I'd like to open the phone lines now to the question of what assistance do you find most helpful with NHSN enrollment and data entry for COVID-19?
And again, that's *1 on the phone lines. All right, there are no questions on the phones.
Thanks. I'll turn it over to Sophia. Are there any questions in the Q&A?
Hi, Tracy. No, we don't have any new questions in the Q&A.
Hey, if it's okay, I'd like to jump in. Hi, it's Joe Pers again from CDC. And, regarding this prompt, one of the things that I'd like to highlight is that the NHSN module is allowing, not just for like traditional case reporting, but it also provides a means for our nursing home partners to communicate about resource needs, things like PPE shortages, staff shortages, access to testing, and alcohol-based hand rub. So I hope that folks are using that and, more importantly, starting to see some benefit, some response to the shortages that they may be identifying. Thanks.
Thanks so much.
I know that I'm sorry. I would also add that I know that our federal partners, other agencies, are looking at that, and so I hope that people there at the facility level are recognizing some responsiveness. I hope that that's happened to date. I predict that that will happen increasingly. So thanks to everybody for engaging in the NHSN reporting on both cases and resource needs. Thanks.
Thanks, Joe. Really appreciate those are great points to highlight. I'd like to move on to our last example and introduce two more team members from QIO HQIN. With more than 25 years of experience, Sheila McLean understands strategic planning and regulatory compliance. She knows the importance of process redesign to effectively meet performance and quality improvement goals. She's the Vice President with Health Quality Innovators and responsible for driving multiple quality improvement initiatives across various healthcare settings. Sheila obtained her Bachelor's of Science in Healthcare Administration from Virginia Commonwealth University and her Master's of Business Administration from Liberty University. She's a licensed nursing home administrator in Maryland and Virginia and is a certified professional in healthcare quality. Karen Southard is the State Director for South Carolina for HQIN, the QIN-QIO. She is a registered nurse with expertise in healthcare leadership and quality improvement in acute care settings. She has over 9 years of experience with the QIO program and supported nursing homes, hospitals, and community coalitions. Karen has a bachelor's degree in business, organizational development, and a master's degree in healthcare administration. She is a certified professional healthcare quality and is a senior leader at the Carolina Center for Medical Excellence. I will turn the floor over to you, Sheila.
Thank you, Tracy. We appreciate the opportunity to share about our state partnerships within the Health Quality Innovation Network, or HQIN, service area of Kansas, Missouri, South Carolina, and Virginia. Karen is going to share with you today about our partner activities in South Carolina, and then I'll speak to activities in Virginia. So Karen, I'll turn it over to you.
Thank you, Sheila. Next slide, please. Next slide, please. Thank you. Well, good day, everybody. I'm pleased to talk about South Carolina today and our state partners that have been instrumental in supporting nursing homes during COVID-19. We currently have 30-minute meetings together every week, and these began back in April 15th as a way to have standing discussions around the COVID-19 spread, the challenges for the facilities with active infections, The sharing and the success of the ICAR target assessments and our, also the COVID-19 focused assessments. We also wanted to see what education, resources that we could push out to the facilities. So I'll talk a little bit about South Carolina. South Carolina continues to be hit hard with COVID-19 and continued increase in cases. But through this partnership, we believe that we have put together a systematic approach in which we can provide real-time support to our facilities and help them navigate through these difficult times. Our South Carolina Nursing Home Support Team is comprised of members from our South Carolina Department of Health and Environmental Control, DHEC, the Divisions of State Survey, and HAI sections, which Department of Acute Disease Epidemiology. Our South Carolina Leading Age and our South Carolina Healthcare Facilities Association leaders join with our QIN-QIO on these meetings. On average, about 14 different individuals, professionals attend these calls. Through this partnership, the team has identified several things that we've been able to act upon. A lack of resources for nursing homes were early identified, and they did not have any resources to perform the N95 fit testing. So I reached out to our partners at the South Carolina Hospital Association, who's already navigating a whirlwind of issues with our hospitals, and they were instrumental in helping with us to coordinate a process in which we engaged the National Guard to help organize a statewide process so that our facilities, through the local county emergency manager, can request fit testing now and for our nursing homes. Through weekly sharing of ICAR findings and the COVID-19 focus surveys, as well as some of the QIIs that we've already seen common gaps and identified needs, we're able to discuss on an aggregate level and prioritize educational lists. And we began offering open nursing home office calls for all of our facilities within South Carolina. The first call was held on June 17th, and we spoke to the results of the state COVID-19 testing. In the weeks coming, Pat Kopp, our DHEC HAI coordinator, who is a valued partner with in this work, she is going to be presenting on the open office calls, managing resident flow according to CDC guidelines, and reducing the risk of transmission when contract staff access your facility. So these were all discovered during our conversations and when we're doing risk vulnerability assessments with the facility, or frequently asked Q&As by our nursing homes that we feel that there's enough of unknown that we need to address it in a more formalized process. I am happy to report as well that South Carolina now has 99% of their nursing homes now reporting into NHSN. From the very day that NHSN data was being able to be accessed, Pat Kopp, she prepares a summary each week and brings to the meeting and talks about what they're seeing in the data. As Joe referenced before, the data really helps us to drive our strategy. And so we are now able to see and identify where there's potential PPE supply, staffing shortages, and as well as we're monitoring reported cases. Like I said, South Carolina is having elevation in cases, and so we are now able to help to proactively monitor and communicate with nursing homes. We're able to look at those high cases. We're also able to hotspot in the communities with outbreaks, making facilities aware of their vulnerabilities, aware, and also being able to support them with whatever resources they potentially need. We are collecting all of these best practices, and we're also sharing success stories through our HQIN news feeds as well as our social media. And with that, I'd like to turn it back to Sheila.
Thank you, Karen. Next slide, please. So in Virginia, HQI and the Virginia Department of Health, or VDH, have successfully worked together over the years, aligning quality improvements across all settings of care. And HQI, VDH, and the Virginia Hospital and Healthcare Association co-lead the Virginia HAI Advisory Group, which also includes our Nursing Home Trade Association and representation from long-term care providers. During the pandemic, HQI and VDH have primarily focused on addressing long-term care facilities. We meet regularly or have regular discussions regarding the nursing facilities, and specifically looking at those that have had ICARs, focused COVID surveys, facilities with NHSN reporting issues, and facilities that are part of the HQIN network, and any infection control quality improvement initiatives that facilities may be working on. And then we discuss all of these issues and activities so that we can coordinate our outreach messaging and the type of support each of us will provide so that we're consistent and we reduce duplication of efforts for the facilities. Both organizations also participate on Governor Ralph Northam's Virginia COVID-19 Long-Term Care Task Force. And that task force also is made up of our Hospital Association, our Nursing Home Trade Association, the State Survey Agency, Ombudsman, and many others. Too many to list. But through the task force, we've been able to collaborate on a long-term care COVID-19 transfer form for acute care and long-term care facilities, COVID testing, and infection prevention education. And it's because of our long-standing relationships that we've been able to quickly respond to the needs of nursing homes across the state. So next slide, please. So Karen and I thank you for this opportunity to share this afternoon. And next slide, please. I will now turn the call over to Pat Kopp with the South Carolina Department of Health and Environmental Control. Pat, it's all yours.
Thank you. I'm Pat Kopp, and I am the HAI coordinator for South Carolina and a certified infection preventionist. The South Carolina Department of Health and Environmental Control has a long history of collaboration with CCME. Prior to COVID, our most recent work included antibiotic stewardship, and we've been valuable partners for quite a long time. In March, the South Carolina HAI section began doing proactive tele-ICARs with our long-term care facilities. Our HAI program, with assistance from CDC, has performed over 130 proactive and reactive tele-ICARs in South Carolina nursing homes, as well as assisted living facilities. South Carolina also recently performed statewide, facility-wide testing for all nursing home residents and staff. The HAI section, along with our regional infection preventionists, are responding to nursing homes with guidance relative to cohorting, PPE issues and shortages, and return to work guidance for staff. Our partnership with CCME and other nursing home partners has been so valuable. We're collaborating on issues around NHSN data quality, fit testing for respirators, testing and retesting guidance and resources. Recently, we've begun to host office hours, as Karen mentioned, every other week. Our first one was a preliminary look at the data that we've collected during our statewide point prevalence survey or testing that we did in nursing homes. And so we really value this partnership with Karen and the CCME team. I think it's really adding a lot to our nursing homes in South Carolina. And I'll turn it over to Sarah Lineberger, the HAI coordinator for Virginia.
Thanks,
Pat. Hi, I'm Sarah Lineberger. I'm the HAI coordinator in Virginia and work closely with health quality innovators and have for many years. I know we're a little short on time, so I'll just echo the earlier comments that, you know, our relationships across organizations prior to the COVID pandemic have been so important so that when the COVID pandemic started, we were able to just pick up the phone and call our friends down the street, whether that was, you know, our QIN-QIO or other associations and clinicians, and we've been able to all come together under the direction of the Governor of Virginia to have this long-term care task force in Virginia. I help lead that in conjunction with Dr. Lori Solano, who is our Deputy Commissioner for Population Health at the Virginia Department of Health. And we've really appreciated HQI's input and, you know, had several calls with them. We work closely with them and lead, as Sheila mentioned, the HAI advisory group. And so I think we had a really good foundation with our statewide advisory group, and we're able to just expand that further and focus on nursing homes a little more with the COVID pandemic. So thanks for this opportunity to highlight these partnerships, and I will turn it back over to our CMS partners.
Thank you so much, Sarah. We'd now like to open the phone lines again. We'd like to hear any feedback that you have on what you've learned today and how that may impact your work and strategies going forward. Or you also may enter that in the Q&A.
And again, that's *1 on the telephones. There are no phone questions at this time.
And I'm not seeing any in the Q&A either. We'd like to encourage you to share what you have learned today with us so that we can prepare future experiences for you as well. With that, I'm going to turn it over to Sophia Autry for our closing.
Thank you so much, Tracy. Hello, everyone. This is Sophia Autry, and I just want to thank everyone for participating in today's call. We hope you found some of the information valuable for the topics that were discussed. Please take a moment to complete the survey from today's event. And we also wanted to make sure that the link is included. So we wanted to make sure that if there are any items that you would like to hear, or you want to provide us anything that would make this presentation better, please put that in the survey. And I think that is all that we have. And we can use this information to improve any of our future events. That's all we have for today. So I want to thank everyone and have a nice evening.